Close to 80% of malaria cases are in sub-Saharan Africa, and most of those patients die, according to the World Health Organization. Dr. Tom Frieden, director of the U.S. Centers for Disease Control and Prevention, saw that for himself when he visited West Africa.
As I walked into the hospital, I walked in with a father who was carrying his 4-year-old son who was dying from malaria. So it's still a deadly problem in Africa. We need to persist in our activities, expand them, and also figure out new ways to stop this terrible disease.
Frieden says more children should sleep under bed nets, and both children and adults need to receive better medical treatment. In addition, new treatments have to be developed.
We're seeing real problems with drug resistance. Use of the pills that have combinations of what are called ACTs or artemisinin combination treatments in place should reduce the likelihood that the drugs that people take cause resistance in the malaria parasite, but we're seeing pesticide resistance to some of the pesticides in the bed nets.
In West Africa, until very recently, most medical resources went to fight Ebola, and malaria patients went untreated.
Whenever you have more malaria cases going untreated, what that results is first of all, one result is more malaria deaths.
Mateusz Pluczynski, a CDC researcher, spoke by Skype. The CDC found that untreated malaria surged in Guinea during the height of the Ebola epidemic and caused far more deaths than the Ebola virus. Pluczynski said the findings likely hold true for Sierra Leone and Liberia as well. Although funding increases have led to unprecedented treatment and prevention efforts in sub-Saharan Africa, more needs to be done.
We have to continue to find breakthroughs on malaria, to look for a vaccine or a way to control mosquitoes more effectively, because malaria remains a horrible challenge.
Experts say malaria can be prevented. The challenge is to do it. Carol Pearson, VOA News, Atlanta.